India's Doctor Death, once thought to be a chilling title of a Netflix documentary, now has a terrifying echo in real life. Now, in the small town of Damoh, Madhya Pradesh, truth turned stranger than fiction. A man posing as a celebrated UK-based cardiac surgeon has left at least 7 families in mourning after botched up surgeries that he was never qualified to perform. He called himself Dr. Narendra, but in hospital corridors, he went by the name of Dr. Kem, impersonating a real British heart specialist. With a forged identity, fake degrees, and a white coat that gave him false credibility, he performed over a dozen open heart surgeries without any formal medical training. One of his victims was Ramesh Sahu, a 47-year-old school teacher and a father of 2. His family had pooled savings, sold jewelry, borrowed from neighbors to afford the surgery, but Ramesh never made it back home. His wife says, and I quote, "We were told it was a routine procedure. I even thanked the doctor after the operation. I didn't know I was thanking the man who killed my husband," unquote. Well, this is not just about one man's deception. It's about a deep systemic rot that allows such horror stories to unfold in plain sight. According to the Indian Medical Association, there are an estimated 10 lakh quacks across the country, individuals who pose as medical professionals practicing modern allopathy without a shred of qualification. They treat patients, prescribe medications, even operate, often with deadly consequences. So why is this really happening? This happens because India's public healthcare system is crippled by shortages and neglect. The doctor-patient ratio stands at a worrying, especially in rural areas where access to quality healthcare is nearly non-existent. People are desperate, and in that desperation, quacks find their perfect cover. In the Damoh case, Dr. Narendra wasn't hiding in the shadows. He operated from a missionary hospital under everyone's nose for months together. The hospital is now under investigation. Questions are being raised about how such a colossal breach went unnoticed. The National Human Rights Commission has stepped in as well. It has taken suo motu cognizance of this matter. Legal proceedings are underway. But what about the others? How many more doctor deaths are silently operating across India? Until the system begins to weed out quackery, strengthen regulatory checks, and make real healthcare accessible to all, these aren't isolated incidents. They're part of a grim pattern. And families like Ramesh Sahu's will keep asking, was his life worth just so little?